Southern 7 Health Department and Head Start, making a difference in your community, one family at a time.
Welcome back to the Southern 7 podcast. I'm Shawnna Ryan. Joining me today is Karen Young. She is the Midwest Regional Manager for the National Ovarian Cancer Coalition. Hi, Karen. Thanks for being with us today.
Oh, hi, Shawnna. Thank you for having me. I appreciate it.
Sure. Tell us about yourself.
So, as you mentioned, my name is Karen Young. I live in the Chicago area, and I oversee the Midwest region for our national organization. We have 10 regions across the country, and so I'm here in Illinois, but I also oversee 5 surrounding states that include Indiana, Missouri, Iowa, Tennessee, and Kentucky. So those are all the states in my region here. And I've been with the organization for 11 years. And we are focused on awareness of ovarian cancer.
Okay, and the reason that you and I are talking today is because the NOCC is part of the Talking Ovarian Cancer Project, which is a project that Southern 7 partners on. And so we've invited you to come and talk with us today about the coalition and everything that's involved in that, because the folks in our region will probably start talking to you a lot more in the months and years to come. So we wanted to make sure everybody knew who you were and got familiar with you. So thank you so much. So tell us about the NOCC. What is its mission? Who are the people you serve, and so on?
Sure. So the National Ovarian Cancer Coalition is an organization that's been around for 30 years. It started in Boca Raton, Florida, with a survivor who was going through late-stage ovarian cancer and wanted to get awareness out in the community. This is a very deadly disease. Our mission is to educate the community and to provide programs and services for ovarian cancer survivors and their caregivers. Because this is such a devastating disease, usually diagnosed later stage because there is no early detection for ovarian cancer, getting out in the community to spread awareness is hugely important.
So where are you located? Where's your hub?
So our headquarters is in Dallas. And then, as I mentioned before, we have 10 regions across the country from coast to coast. My region is considered the Midwest region, but we do also have a splattering of markets on the East Coast and more in the Midwest, not quite. We're making our way more on the West Coast. We don't have anyone proper in California area, but we are spread from coast to coast as far as our programs and services.
Okay, really good. Now, we talk about all types of cancers down here in Southern 7 and how difficult it is for people to access care on a regular basis here. I often say we are in a health desert in this part of the country. So are there other collaborative efforts that you're involved in our region down here to help spread the word about ovarian cancer prevention and knowledge?
Yeah, my biggest collaborative effort is being on the Talking Ovarian Cancer Project. It has been really eye-opening for me, living in the Midwest my whole life, but living in the northern part of the state. Things are a lot different in the southern part of the state, as I've found out. And so being a part of this collaborative team, really getting to understand the needs for the folks that are more in your area than mine has been hugely helpful and has really been good timing for the programs and services that we have executed just over the last couple of years during the pandemic.
Okay, good. So again, we'll start seeing you more in our region as people start getting more information about the TOCP or Talking Ovarian Cancer Project and the outreach that we do. So good. I'm glad that that's continuing there. Now, how is your organization focused on health equity? Tell us about that. And what is health equity as well?
Sure. Health equity is making sure that all people everywhere, and especially for us, we're talking about women, that all women everywhere have access to the same care. And for looking for ways that we can supplement and fill in the gaps for where we're falling short, for folks in the community that have a lack of resources, located very far away from those resources, and how we can help them to get up to speed with everyone else that has had good access, whether it be financially, whether it be geographically. And so over the last couple of years, we, like a lot of organizations, have made a primary focus on providing programs and services that are going to help those that are in the greatest need. one of which being our financial assistance program that just debuted a year ago. We never did have financial assistance, and that's one thing that's really hard for cancer patients in general to find, but especially with ovarian cancer. I would feel really bad when women would call up and say, is there any assistance for me? And there wasn't much out there that I could direct them to, and we certainly didn't have our own, but now we do, and we have 2 programs, and we also have free meals and free counseling. And so for women who are struggling, making it through their treatment and finding that they need services like this to help them, just to survive from day to day, we now have programs like this that can help them in those gaps.
So do those patients have to fall within a certain income guideline? How do they qualify for those types of programs? And what exactly do they get through those programs?
Sure. So they do. I don't know all of the requirements. We actually work with the Patient Advocate Foundation, that they do their applications through them and they monitor everything for us. I want to say that the financial assistance is 400% above the poverty level. And most people that apply do get our financial assistance. And there's 2 different programs. There's $1,000 a woman going through treatment can get if she qualifies. And then if you happen to be going through a clinical trial, $2,500 can be awarded for your stipend for traveling and food and lodging and things like that. Then we also have our Comfort for the Soul, which is our meal program. And we partner with a company, I want to say we're partnering with Sunbasket right now. And so women can request meals for themselves and their caregiver. You can get them for up to 8 weeks. They are free of charge. They come fully cooked. You just have to reheat them. And the person who manages that program will step through all the dietary needs to make sure that things are going to be in line with the diet that the doctor or the nutritionist has prescribed for you after treatment. And then we also have our Comfort for the Mind program. We partner with BetterHelp, and you can get 3 months of counseling if you would like to talk with a counselor one-on-one, since we know that psychosocially going through cancer treatment is quite difficult. And some people, both patient and caregiver, may feel like they need those services. But in addition to those partnerships that we have, we also have our own internal support groups that are online monthly for both survivors and caregivers as well. So we do foster a community here of people that can network and support their peers.
So it's not just making sure that patients have access to medical care. It's the whole, the all-around wholeness of what a patient would go to, because it's really kind of easy to say, okay, we're going to go to the doctor and we're going to get this checked out.
Right.
Then what's next? And usually it's the what next that patients have the most difficulty with. And that again is something that we see in our region, especially regardless of income. We see that, just for a patient in general. So you offer that wholeness, that whole approach to it. And that's wonderful.
Well, and one of the eye-opening things I was going to say that I mentioned that I've learned through being on the Talking Ovarian Cancer Project is that one of our premier programs, which is our Faces of Hope tote, which we stock in some of the top hospitals, that is the first kind of welcome introductory gift that women get. And in that will be a newly diagnosed guide. It will have some pamphlets and information for family caregivers to understand how to support their loved one as they're going through this. But we stock those in top hospitals. I'm in the city of Chicago proper. If you are talking about rural hospitals that don't have gynocs, might not even have access to gynecologists, they're lacking the ability to just have that basic care that we take for granted here, in a big metropolitan area.
Now, do you partner with any of the hospitals down here in the Southern 7 region, or just in Southern Illinois in general?
So we do have a few hospitals that we have worked with on occasion. I don't have anyone right now. I'm working on getting some of our hospitals that are in the middle part of the state to actually stock our totes. But on occasion, we have partnered, we have lended our awareness materials, come down to certain women's symposiums and health fairs, but I haven't worked really closely with any of the hospitals in the southern part of our state yet.
Okay, well, and again, what we're trying to do in the Southern 7 region is still new. The TOCP has only been around for a year now, so that's still new. But I can see that, going forward, the partnerships that are created are going to be able to provide services for the families here that really need them. So
right, and that is one of my aim and goals. When I joined the project, one of the reasons was I know that we're lacking the resources in the southern part of the state for people to have access to what we have. And so I do hope by the end of this year and early part of next year that I will have some partnership with some hospitals to actually stock our totes and some of the other great programs and services information about that, so we can get it out more in the community.
All right. Karen, we've been talking about NOCC all along.
Yeah.
Let's shift gears a little bit and talk about actually ovarian cancer and what a woman needs to know when she's talking with her doctor, because as we know, there is no screening for ovarian cancer. I think we kind of get in our minds that the pap smear covers everything, and it doesn't. So what would you share with women that need more information about ovarian cancer?
Sure. We get out in the community and go to a lot of health fairs and love to really dispel a lot of myths that women have about their own bodies. Before I started working here 11 years ago, I didn't know anything about ovarian cancer. I mean, what do we know about our ovaries except for what they're for, you know?
Yeah,
exactly. If there's something wrong with them, you don't know until until it's very late.
Mm-hmm.
So as you mentioned, there is no early detection test. One of the things that people think is that a pap smear detects all of your gynecologic cancers. And really that's for cervical cancer.
Yeah,
there's a mammogram for breast cancer, people get their colonoscopies. There are so many other tests that people are familiar with. And so it's just easy to think, when you go to the doctor, you want the doctor to tell you what you need to do, right? And so the simple fact is we think that we're on top of things. We think that we're taking care of ourselves and being proactive. But because this disease has symptoms that are so vague that can be mistaken for other things or things that kind of come and go and you blow off, such as bloating. What woman hasn't felt bloated at some time in her life, or maybe every month of her life, but these are symptoms, even though they're vague, that come on, you don't experience all the time, and they seem to persist and don't go away. So like the top four, bloating, feeling full very quickly after you eat, also having to go to the bathroom to urinate very often, but probably the most telltale sign would be pain in the pelvic or stomach area. If those four symptoms actually come on and they're not normal for you, and they just don't seem to go away and they seem to be getting worse, especially for women who are feeling the bloating and it's getting worse and worse, you're getting larger, looking like you're actually pregnant and you know that you're not, that there's something seriously wrong there. And so we encourage all women to make an appointment, talk with your general practice doctor, but definitely if you can talk to a gynecologist, because even though there is no early detection test that we would have on an annual basis administered to us, there are two things that they can do to get a baseline and kind of find out. A CA-125 blood test can help kind of measure the level of whether or not you are in a good range. Some women are just totally off the charts with their CA-125. And so that's kind of a good telltale sign, but also a transvaginal ultrasound. So they can actually take an ultrasound of your ovaries, of the area, and see if there is a tumor there. Both of these tests are not reliable enough to be regular early detection tests that they would recommend for women at a certain age every year, but they are tests that can help verify whether or not your symptoms are saying that you have ovarian cancer. So those are the things that we try to recommend to people, because also the symptoms that I mentioned can easily be mistaken for things like irritable bowel syndrome. And I can't tell you how many survivors over the years have told me they go to their general practice doctor, they're referred to a GI specialist because that's what they think that their symptoms are leaning toward. They start treating them for IBS for a number of months. And when that's not working, they go back to the drawing board. Eventually ovarian cancer is discovered, but look at all the time that was wasted as a woman would see it. And we know medicine is a practice. And so doctors don't always get it right. They don't always know. They're like investigators. They have to put these pieces together. But what we always hope is that with women being proactive about their own health care and being, armed with the knowledge of these symptoms, that they might kind of, doctors don't like when you do research and come in and say, I think I have. But at the same time, if you've got a family history, you've got a mom or a sister who's had breast cancer, ovarian cancer, the genetic link between these cancers can be important. Although it's not necessary to get ovarian cancer, if you have a cancer history in your family, important to bring that up when you talk to your doctor, because that builds your case more for them taking you seriously, that this is something that you really should check out and try to eliminate.
Well, and when you start looking at the statistics in our region, in the Southern 7 region, and you pull up, colorectal cancer and breast cancer and lung cancer, you can see those are high. But when
Right.
it comes to ovarian cancer, people think, well, we just don't have that. And like you said, oftentimes it's in late stages. It's often mistaken for something else,
Right.
or the cancer has spread to another part of the body. And so you see that increase there.
Exactly.
So, like you said, the best thing that a patient can do is talk with their doctor, be persistent
Right.
in what you're experiencing, and get the treatment that you need from there. Because surgery is the only way to detect this completely, correct?
Correct. Yes. I mean, that's the only way you're going to know for sure, because until you get in there to actually look around, you don't know if it's only affecting, is it the peritoneum? Is it the ovaries? Has it
Yeah.
spread? There's a lot of research being done that sometimes ovarian cancer starts in the fallopian tubes. And so depending upon where it's located at, where it started, what stage it's at, the earlier you get in to be able to discover that and remove whatever needs to be removed. Some women can actually get away without having chemo if it's caught early and it's a stage 1, while others, because of whatever situation they had and the tumor's already grown, it's already metastasized, now we're into a stage 3 or 4 situation where now you're talking surgery and chemo and lengthy treatment, and then sometime maintenance PARP inhibitors for a long time after that, just because of it going on so long and nobody realizing what it was.
Well, the thing is, usually by the time they have the symptoms, that's when they're in those later stages. So is there anything that a woman can do to help prevent this? Is there, I mean, since there's no test for it, is there anything that we can do?
There are, we have a number of things that say put you in a better chance of lower risk. Women who have had children as opposed to not reduce their risk. Women who have breastfed as opposed to not. Women who have been on the pill. These are some things that they have said that if women choose these situations for themselves, that can help prevent ovarian cancer. I know that there's a lot of people that will ask, is there a specific thing that I can take or a specific thing to avoid? And unfortunately, we don't have those kind of recommendations for women. But because it has to do with the reproductive system, that is something that they have been saying, things that have to do with childbearing, and preventing childbirth, that those types of things they have seen lower the risk. And this has always been a disease that people have seen in older women for many years. They didn't think younger women could get it, which is not true. We have had lots of teenagers and those in college, and even some young, small children, between the ages of 5 and 10 that have actually been identified with ovarian cancer. But it still is one that tends to be something you should pay attention to in your later years, postmenopausal, definitely for sure. Those are things that we can at least tell women to be thinking more of, where it may never have crossed your mind before. It's like all women know they're going to go through menopause at some point, but ovarian cancer isn't something that they're thinking about as they get older, is something they should be watching for, asking about.
Exactly, because I mean, like we said earlier, we're thinking about that Pap smear taking care of everything, or the pelvic exam taking care of everything, and
exactly,
that's not the case here. Now, Karen, are there any events coming up in September that you have going on? What are some ovarian cancer awareness events that are coming up?
Well, September is the big month for us. We go all out. So September is the month of teal. And this is our first year back in person with all of our events. And so we have a number of things coming up. So on September 16th, we do a really fun lake and river architectural cruise downtown Chicago with Wendella Boats. They lost their grandmother, the matriarch of their family, to ovarian cancer more than a decade ago. And so for the last 6 years, we have been doing this cruise, especially because we get the buildings lit downtown teal. We get about 20 properties that are lit teal, and it's just a fantabulous, really laid back evening to really enjoy each other's company and see the awareness in the city and try to really make that connection. Like, those buildings are pretty teal, but like, why are they teal? And so the number of survivors that attend this cruise has been growing, just like our walk that we have each year. So we're really celebrating those survivors that are beating this disease, that are actually surviving and thriving much longer with the help of PARP inhibitors. We are seeing a lot more survivors attend this cruise for that reason. We also have a lot of women that like to get out in their community and tie teal ribbons all over the state in different places. And also along with the lighting, the governor's mansion is going to be lit this year.
Oh,
yes, we've
very
never
good.
that
That's
before.
cool.
But one of our volunteers is from Virginia, Illinois, and she tries to do awareness down in her hometown and do things in that part of the state. So she has secured the governor's mansion. And then we have, it got pushed into October this year, but our big walk. We do 10 walks across the country. Every region has one. Half of them are in September, half are in October this year. Our organization aims to raise $2 million through all of our walk events. And here in Illinois, $200,000 is our goal as part of that 2 million. So we are just a shy under 100,000 right now. Our event is coming up on October 15th. And we're pretty excited to have people back in person. This is our 25th annual walk this year. So of the 30 years of this organization, our chapter, our Midwest region has been active for 25 of those 30 years.
Oh, good. Well, make sure we get details on all those events and we'll share them on our Facebook page. That sounds great. Well, and for those that don't know, September is Ovarian Cancer Awareness Month. We kind of brushed over that. That's my fault. But yeah, you've got that going on in September, and it sounds perfect to roll over into October because that's Breast Cancer Awareness Month. So a lot going on for women in our region.
Exactly.
Now, we also have an event coming up here at Southern 7. It's our ovarian cancer webinar, and that's going to be coming up on September 29th. We'll have more information for everybody as we get a little closer to that. We're still working out those details, but it is going to be planned here at Shawnna Community College in Ulin, and so be watching for that. Okay, great. Karen, is there anything else you'd like to share today?
I just think it's really important for us to make sure that women understand that they need to be their own best advocate, and that we really try to arm them with the knowledge that's going to help them have facilitate good conversations with their doctors. We know that doctors are very busy, and if you're not prepared well before you go in with certain questions and certain things you want to focus on, sometimes it's just really easy for that to be dismissed or just not thought about at all. And so we just really want people to have on the top of their mind awareness about this disease so that we can hopefully prevent, more deaths and to have women diagnosed earlier stages when they are in the future.
Very good. Exactly. Yes. When you go to your doctor, I always tell my kids, make that list. Because you're going to forget something.
Yep.
And doctors want to know what's going on. They can't help you properly if you don't share. So make sure you do that. Thank you so much. All right.
Exactly.
Well, Karen, thanks again for being with us today. And we're going to be sharing more out with everyone about the Talking Ovarian Cancer Project. Again, Karen is part of that project. So we'll make sure everybody has information on it. But thanks again, Karen, for being with us today. We appreciate it.